This is Dr. Hawks, orthopedic surgeon at Salina Regional Health Center, to discuss hip osteoarthritis. Your hip joint is a ball and socket joint that's made up from your pelvis bone called the acetabulum and the ball part or the femoral head from your femur bone or thigh bone. The ball and socket allow for a wide range of motion. There is on the surface of these bones a slick surface called articular cartilage. Time, genetics, injury, or bad luck can lead to this cartilage surface flecking away or being worn away, exposing the bone underneath. That can lead to bone destruction and expose the nerves underneath that causes swelling and pain and decreased range of motion. When non-operative treatments fail, we sometimes recommend a joint replacement. A total hip is where we would replace the ball and cup with a cup that goes inside the acetabulum with a plastic liner, and then a metal part that goes inside the hip with a ball. We then put the ball and the hip back together that makes a smooth gliding surface for the hip. Shoulder arthritis and rotator cuff arthropathy can lead to the shoulder joint breaking down. When non-operative treatments fail, we sometimes recommend joint replacement surgery. If your rotator cuff cannot be saved, we would recommend a reverse total shoulder replacement. In an anatomic shoulder, you have a ball that is attached to your humerus or your arm bone, and a cup that's attached to your wing bone or your scapula. In this scenario, we would change the ball onto the wing bone or the scapula and the cup onto the humerus or the arm bone. What that looks like is on this model right here. The scapula has the ball, which is made out of metal, and on the humerus we have the cup that has metal that goes inside the bone and then a plastic liner that acts as a bearing surface. And in this scenario, it can allow for movement of the arm without the rotator cuff. Knee osteoarthritis is a disease that affects the articular cartilage of your knee. You have several bones that make up your knee joint: your femur bone or your thigh bone, your shin bone or your tibia, and a small bone fibula that's attached to your quadriceps tendon and your patellar tendon. On the ends of these bones is a slick, shiny surface called articular cartilage. The articular cartilage provides a smooth gliding surface for your knee. Time, genetics, and injury or bad luck can lead to this cartilage starting to fleck off. That exposes the bone underneath, and that is osteoarthritis. This bone has nerve endings and causes swelling and pain. Sometimes the non-operative treatments don't work, and in that scenario, we discuss resurfacing procedures, such as partial or total knee replacement. In partial knee replacement, we would only resurface the part of the knee that would need to be replaced, the part where the cartilage has worn away. That would be the inside, the outside, or the patellofemoral joint, where your kneecap goes. In most circumstances, or in a higher percentage of circumstances, the entire knee is worn out. And then we would do a full knee replacement, where we would cut the surfaces of the bone and replace it with a metal cap on the femur bone and a titanium part that goes inside the shin bone or the tibia with a metal bearing in between for a smooth gliding surface. Thank you for considering us for your joint replacement surgery. We are excited for you to move forward with us with less pain and increased function.